Hi, I'm Bill Wilt of Assured Research. Thanks so much for joining this quick hit video where we're going to talk about the one big beautiful bill act. I won't try to say that 5 times fast. The recently signed legislation and its impact on workers' compensation. And to bottom line it for you, we think that over time, the one big beautiful bill act will result in the shifting of claims from group health, medical insurance to workers' compensation. We're recording this in mid-July, and if you can remember back, if you may be watching this sometime in early August, in early July there was turmoil across the healthcare sector, the stocks, publicly traded stocks, as several companies withdrew guidance for 2025. Others missed their earnings estimates because of increased utilization, especially across the Medicare and Medicaid populations. And questions arose at that time, in particular, about how changes in the healthcare system would impact workers' compensation. That was one among other catalysts for this note. So I'm going to share my screen, although what I have to share with you isn't so dependent on the slides, but you may want to see what we have here. And while I do that, I'll just thank you for listening to this quick hit video. If you're a subscriber, thank you. And if you're not, then feel free to look around the website, understand our content a little bit better at the YouTube site and our website, and reach out for a trial to our work. So the One Big Beautiful Bill Act and its impact on workers' compensation. And they keep this short and sweet. There are really two scenarios. One is that somebody who has Medicaid, a working adult with Medicaid, presently loses their Medicaid insurance because of the required changes in the One Big Beautiful Bill Act, and they elect not to purchase. They either work for an employer that isn't required to offer medical insurance, or they choose not to purchase it perhaps because of its cost, and they're now a worker who is uninsured. Also, I focused on Medicaid. There were meaningful changes to the premium subsidies in the Affordable Care Act, or at least they're going to now be allowed to expire or be reduced. And so the thinking is, I think from the CBO, that some 11 million people over the upcoming years into a decade could lose their Medicaid insurance, with millions more, single-digit millions more, I believe is the estimate of those who could lose their coverage under the Affordable Care Act. The point being that, and you see here in the red line, that the rate of medical insurance, which is in 2023 and into early 2024, was at least a generational high, if not an all-time high, at around 92%. That's highly likely to go down. How far, we don't know, but it should go down, and it'll go down too among those who are still working. Based on experienced intuition, plenty of conversations recently and over the years with workers' compensation professionals and claims experts, people who are working and don't have medical insurance are more likely to file a workers' compensation claim. So part one, lower insured, medically insured rates among the population should bring some claims that would have otherwise been kept in group health or medical insurance into the workers' comp. That's likely to be soft tissue injuries, where the origin of the injury is maybe uncertain as to work or home, and injuries like that, but as opposed to traumatic injuries where it very clearly either happened at home or it happened at work. But nevertheless, shifting of claims for that reason, part one. Part two, you have people who will lose their Medicaid coverage, which has expanded dramatically in the post the Affordable Care Act, with an acceleration through and immediately after the pandemic, or the Affordable Care Act, which has reached all-time highs as well in 2023 and 2024 because of increased subsidies passed by acts that became law following the pandemic. That, very interestingly, that increase in Medicaid and Affordable Care Act take up has been the primary driver. And if you look on the right hand side here, look at the dotted line. What you're seeing is the take up rate of employer sponsored medical benefits across a number of different occupations. We picked occupations based on the occupations that purchase the most workers' compensation insurance. But for these purposes, just look at the dotted line. You have the take up rate falling in the 2017-2018 timeframe from about 73% down to below 65. They're basically a 8 to 10 point fall in the take up rate of employer sponsored medical insurance. So you might say, gee, the good news is, and it is good news, that people who could lose their Medicaid or Affordable Care Act coverage as a result of the One Big Beautiful Bill Act can go back on employer sponsored plans. That's good news indeed. But most of those, virtually all of those employer sponsored plans come with deductibles, oftentimes substantial deductibles. And research from the WCRI was released in 2019, where they evaluated claiming behavior for employee injured workers with and without high deductible medical plans, found very clearly that those injured workers with a higher plan were more likely to claim workers' compensation, especially for soft tissue injuries, sprains, strains, and tears, where again the origin could be fluid. Now, good news is those are, even if they're higher frequency, they can be up to a third of total claims for, at least in the state of California, based on some recent data that they released. The good news is they tend to be of lower severity. But in the main, we've got a workers' compensation system that has for decades experienced declining frequency. This certainly, the One Big Beautiful Bill Act, we think creates a headwind to the continuation of that very favorable frequency trend. So that's what we have for you. While I stop sharing, I'll just say thank you. Reach out for more on this as part of a trial to our work, for instance. And again, we thank you for the interest and hope you have a great rest of your day.